Hey everyone, welcome to the Happy Flosser podcast. My name is Billie Luntz. I'm your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is so fantastic to be with you today. And guys, I'm so excited about my guest today. So I have Carmen on, and Carmen has I actually can't wait to hear the whole story. So she is a myofunctional therapist, isn't it? Guys, I know you guys will be so excited to hear her story. So she is with us today to talk all about her journey and really kind of give you guys a little insight to that type of career shift that can take place. So, Carmen, welcome to the podcast.
Hello, thank you. I'm so excited to be here.
So I always love having chats with fellow dental hygienists. So, tell us a little bit about yourself and we'll get started on this conversation.
Oh, wow. Okay. I like to tell people I am a recovering dental hygienist because I still was a dental hygienist longer than I have been anything else, but I'm quickly closing on that. By background, I was a dental hygienist for 15 or 16 years. Now I can't remember. Um, and it just what I had a whole host of things that just made me realize that wasn't for me. So at some point, about a decade ago, I discovered myofunctional therapy, and like cannonballed off the high dive into the pool, and here I am. I have not been a practicing hygienist for the last 8 years, doing full-time myofunctional therapy.
Oh, and honestly, so many students have asked me about that journey. So I'm really glad to connect with you so that you can share kind of how that actually happened and when did you realize you wanted to explore something new like that?
Yeah, that's great that they're hearing about it so that they can inquire about it.
Yeah. Yeah, for sure. Because that is a career shift. Although it makes sense to me that it's connected because I mean we are all up in the patient's business in that area of the assessment. So
Yeah.
um what does that look like? What is that like what does it look like to be a myofunctional therapist to take that leap and
Oh, what does it look like? Well, it looks like yoga pants. I say business on top, party on the bottom. It look to me when I look at it, it just looks like freedom for me because now I built an online business. I built an online business before COVID made it cool to work online. And so that's what's so different for hygienists who are considering is like they're like, wait, I don't have to go to the operatory. I don't have to wear scrubs. But otherwise, to me, that's just what it looks like is just freedom and relaxation. I mean, I'm in shorts, a t-shirt, and sneakers.
I love that for you.
I love it.
I love
Yeah.
that for you. And I think that's a great point. I think a lot of hygienists that are out there practicing and are listening to this, it's hard to picture yourself as a dental hygienist who could have a remote job,
Right.
So,
Yeah.
so how did you first discover myofunctional therapy?
Oh gosh. So I learned about myofunctional therapy very early on in my career, like year one, as a hygienist. And so I was at a conference. I think it was probably RDH under one roof is where I was. And I learned about it. I learned enough to be dangerous in that, it was probably a 4 hour workshop or something, which is funny now because, that I teach myofunctional therapy. It's like, well, 4 hours wasn't exactly enough to get me launched. But the biggest thing is that I learned about it, exposed me to it. And at the end of the day, though, I was a new hygienist and I needed a paycheck, you
Hmm
know?
hmm
And also I wasn't miserable yet at that point. I was just like so excited about this new career. I was a non-traditional age hygiene student. So I was like, my kids were partially raised. I was ready to just get out and make some money. So I kind of put it on the back burner. I always knew it was there and that I could do something with it, but it wasn't until many years later when I got burned out. Pretty burned out. And we might get into, the different reasons, but I had a boss who she got a big fat cost of living adjustment, which changed the production goals. So suddenly
Mm.
I had to produce more, I had to kill myself more. It changed our bonus structure. It changed so many things. And I was like, okay, I got to explore something different. I started having heart palpitations on the way to work.
Oh,
And that's when I was like, okay, something else has to give here. So I started researching again. And if you start researching what else a dental hygienist can do, the options sometimes are about as exciting as watching paint dry. Like I wasn't interested in doing dental research. I had gone back to school and gotten my master's in business before I started my myofunctional therapy business, thinking that that was going to be the answer. And let me tell you, I being a hygienist didn't fill my cup. Being a dental consultant didn't fill my cup either,
mm,
because trying to tell a dentist how to spend or stop spending money was like, oh my gosh. So I researched all these different things. None of them appealed to me. I didn't want to do sales. I didn't want this. I didn't want that. And then I landed back on Myo and I was like, oh, yes,
yeah.
this is it.
Carmen, you point out something that I think a lot of hygienists face, and that is, what am I going to do if they're stuck in the operatory and they're all of a sudden saying, oh my gosh, what am I going to do? And it literally feels like it's education, sales, or research.
Or
And
start over.
or start over in school for something else. And that is such an awful feeling for someone who says, "Oh my gosh, I'm in this job. I'm maybe they're 5 or 6 years in, and all of a sudden this is how they're feeling." And it's the limits, we put those limits on ourselves. But I do think that if you talk to someone like yourself, who can really inspire you to be creative and think outside the box a little bit, you do realize that you can build. Nothing's ever wasted. You can build
Right.
on the skills that you already have. And you've done just that, which is so great. And that's why I was so excited to have this conversation with you, because you've built, you didn't just walk away from dental hygiene. You actually are exploring what's possible to develop more skills and really
Mhm.
enhance what you already know. So that's what I just love that. So how did those hygiene skills translate to myofunctional?
That's a great that's a great question. And I got to tell you something before I answer that, because when you're talking about these transferable skills, so right about the time that I was discovering, hey, I'm pretty unhappy here.
Yeah.
And I can't imagine a life of doing this, I heard a podcast, but it was by Jenny Blake, who
Mm.
she's a author of the book Pivot. And so she talks about pivoting or exploring your pivot, much like in basketball, where you plant one leg and you're just pivoting and you're looking for your strengths. You're looking for somewhere to pass the ball. And so I got her book, I read it, and she was really talking about like diving into your strengths. So what I how I started to find those transferable skills, if you will, is I was just evaluating what it was that I loved about hygiene, what was I good about hygiene, those type of things. And a lot of those skills like common sense, caregiver's heart, aside from our type A skills, like our organization, because some of our type A skills make myofunctional therapy difficult for us because we're
Mm.
like perfectionistic and we procrastinate, but those other skills, um really being like, I loved helping people. That was my strength. That was the reason I was afraid to walk away from hygiene, is because I loved helping people. And so though just being able to talk with people about why they need something. So think about perio disease. How good most of us, hygienists that have been there for a long in hygiene for a long time, we get really good at explaining to somebody why they need
Mm.
scaling and root planing. And so the same thing with myofunctional therapy or with oral facial myofunctional disorders. It's like, hey, I see you have this. So we're really good. We have a caregiver's heart. We're really good at explaining and educating, and I hate the word selling, but really selling somebody on why they need something. I tell my students, we don't sell anything. We offer a solution to the fact that somebody has already raised their hand and said, hey, I'm having trouble with this.
That's a that's a good point. I think we're guilty of not seeing what our transferable skills are and
Mm.
being able to articulate them outside of the operatory. And we are great communicators. We
Mm.
are great at building a bridge between a need and a treatment. I love
Yeah.
that you
Yeah.
pointed that out. And that can go anywhere with you.
Exactly. And also I think, we kind of have that focus of oral health, but when you get into myofunctional therapy, what happens, the transformation that happens for people in their life, in their overall well-being, in so many different things. It's just that's where why I get so excited about it is because it's not cleaning teeth. And I know we're not supposed to say just cleaning teeth. We're just cleaning, but it's like there's so many different things that can happen
Yeah.
outside
Well,
of that.
you give me hope for our profession and our providers.
Well, I mean, I think there is hope because I think the more people that I meet, I just had a student recently who entered my program who she did a table clinic in hygiene school on myofunctional therapy, so I think it's starting to get introduced a little bit more. I used to do a ton of annual speaking events at different hygiene schools, just introducing them. Hey, this is an option. But aside from that, there's also a component of myofunctional therapy. And I think you and I visited about this that I really wished everybody learned because they would be able to help their patients so much better. Versus me, I was just able to say, are you mouth breathing?
Yeah.
Bloody, spongy anterior tissue. Oh, yeah, you're mouth breathing. So I would document it, but I didn't know what to do with that information. Now I'm embarrassed to think about what I could have done with that information.
Well, when you know better, you do better. So,
Amen.
you
Amen.
know,
Yeah.
I think if I put my student hat on and I've, just graduated and I've entered the field and I'm doing clinical hygiene and I see a few patients who maybe I diagnose as mouth breathers and talk about their caries risk or perio issues. And then it sparks that desire. What would what would my next steps be in order to actually pursue something? Because sometimes I think early clinicians, those first 5 years, have that imposter syndrome where they don't feel like they actually have the confidence to talk about things like myofunctional therapy sounds really intimidating and it's not in the compendium and they didn't learn about it in school and it would have to be all built on their own continuing ed after they leave school. And that sounds really scary, but so
None
necessary.
of them want any more school right now. Right?
True. True. Yeah.
Yeah. So for somebody in that situation, I always, when I have the opportunity to tell new or nearly licensed hygienists, I I wish they all had the clinical training
Mhm.
of Myo because of what they can do with it. So they can take that information and just help people. They
Yeah.
can help rather than just documenting that there's a tongue tie, rather than just documenting that Johnny has crowded teeth and a crossbite. Like those are things that need to be addressed, and a lot of the time sooner rather than later. So having that knowledge just makes them better clinicians, better to help their humans. But also, then if they have, so I teach both clinical and I teach business, and
Mhm.
I teach them separate because if somebody's just doing the clinical, they may not even care to have a business. They just might want to know it and have it as a skill. So that's great because then they get to decide if they want to add the business stuff onto it, but they get to decide what they do with it. So it could just be in the chair, but they've got that knowledge in their back pocket. If something happens in life, kiddos get sick, parent gets sick, something happens, they have a neck injury, they have bad wrists, they have this, they have that. Um, I mean, my youngest daughter went through cancer treatment a couple years ago, and I was able to pick up my business and
Mhm.
go. And so I always just say, if anybody's curious, just get the clinical training. However, However you get that, get it so that you can start talking about it. So you can screen for tongue ties. So you can, because tongue ties um have a repercussion. Once the face is developed, the face is developed. There's not a lot of
Mhm.
changes that we can make. And with sleep disordered breathing and sleep apnea and upper airway resistance syndrome being like, sleep screening should be part of what we're doing anyhow. Catching things early, sleep apnea is a facial development issue
Mm.
for the most part, unless it's central apnea, which is in the brain, but obstructive apnea. So I just feel like having that knowledge makes you a better practitioner. And it's great for conversation.
Yeah, absolutely. Well, and building awareness for our patients, for our colleagues. Every time I talk to someone who's a myofunctional therapy, I'm like, oh, tell me more about that. That's so fascinating because I I did the clinical documentation. That's all I did as a provider. I would document and I would talk to the patient about airway and how important it is for them to be nose breathing instead of mouth breathing.
Mhm.
But that was where my conversation ended with patients.
Yeah,
So,
it's like like how do I do that? And yeah, that's easy to say, but what's the practical application of this?
yeah. I love that we're talking about all these things and like mouth tape has become a popular thing and some of the positive things of the internet and negative things of the internet have really kind of sped along the conversation and development of this. Have you noticed that?
Yes, yes.
Yeah. What is the what do you find to be the biggest challenge with providing these services to patients?
Oh, I don't really have a lot of challenges. So, but if I think about my students, their challenges in myofunctional therapy itself is that imposter syndrome, having that
Mm,
conversation, because myofunctional therapy is really something that you have to like use it or lose it. I teach students who, took their training 3 years ago and now they've got a bad neck and they're trying to do, I'm like, you have to be able to use it. So even just having conversations, that kind of stuff. The imposter syndrome is difficult. Also for dental hygienists, I alluded to the type A plus personality. And
A
so
plus.
I know, right? It's so funny. At a conference years ago, the doctor was talking about type A plus, and I asked the difference. And he was like, type A plus, they die, or they have like an 8 times greater chance of like heart attack or whatever than just normal type A. And I was like, okay. But we're just really perfectionists. We're people pleaser. The 3 Ps, I call it:
Mhm,
procrastination, perfectionism, people pleasing. And that's hard because we're dental hygienists. We're good at what we do. We already know that.
mhm.
That's the challenge of venturing in, like dipping your toe into something. You're just like, "Ugh." So they just don't say anything. And that ultimately hurts our patients.
Yeah, for sure. There's a lot to be said about learning new skills, developing new knowledge, and then failing to implement.
Mhm.
That is a hard river to cross for some.
It is. And it's just so hard because we're good at what we do. And so now, think back to when you were learning the mesial and distal of a tooth. Like I remember as a hygiene student when you're like, is this calc? Is this
Yes.
calc? Like, what does it look like? What does it look like? And then the first time you saw it, it was just like the heavens opened up and you're like, that's what it is.
Yeah.
Same thing for things like tongue ties. I don't know about your program, but like my program, we learned what a tongue tie was, but that was it. And of course, it was the worst of the worst of the worst of a tongue tie. But a simple tongue tie affects speech, it affects the facial development. And again, going back to that sleep disordered breathing, like if we fix kids, we won't have adults with sleep apnea.
Yeah. Well, if nothing else, that's motivation to take the leap. If you learn the knowledge and you have the curiosity to learn it, you've got to have the courage to implement. I love that.
Yeah. And to have those conversations because the knowledge stuck in your brain does nothing for your human. And it just, like you just have to, I call it ugly imperfect action. You got to have that conversation. And, my students are so good at just talking to themselves because that's how we practice things. We just unpack it. We just talk about it. So that, I call it 7-layer dip. Like we're just digging. So why does that matter? Why does this matter? Why does that matter? And you just get better and better. And that's the thing is you get better with your explanations and your
Hmm.
education
Yeah.
by doing it and by talking about it,
Yeah.
which is hard because most everybody is super scared. Some hygienists like myself that were so let's just say excited to leave dental hygiene. I was like, girlfriend, like, what's that saying? Storm the island and burn the boats because I put all my eggs in one basket and I didn't have a plan B. Plan A needed to work.
Wow.
It turned out for me.
You know what though? The human behavior, sometimes people need to be put in that situation to make something happen, and
Oh, absolutely.
that's just who most people are, honestly. And sometimes we don't have a plan B because we know plan A has to work.
To work. Yeah. And so
That's
I
okay.
I didn't have a choice. Now, and that is the nice thing about myo and dental hygiene. Like you can control how fast and how slow you make the transition, if you will. And when I say transition, into building your own side hustle, most people don't just go from full-time hygienist to full-time myofunctional therapist. So it's kind of, foot on the gas, foot on the brake type of thing. Where some people will get stalled out is the comfort zone of that regular paycheck, the comfort zone of that familiar
Yeah.
and then the other side. Because even I didn't go, I mean, I went from part-time or I went from full-time. 2 months later I cut back to part-time, and then 13 months later I retired from hygiene. So I again had, I didn't just cannonball into the pool.
Yeah. Well, I think it's smart as a business strategist. It's smart to not jump into the deep end of the pool if you can avoid it, and it gives you time to build your communication skills and your comfort level with the existing patient population that you're treating. So
Absolutely. Yeah.
I just feel like more skills are always better. So
Right.
yeah. Well, this has been an amazing conversation, Carmen, and I
Yeah.
hope our students and early clinicians and any hygienist who's listening finds this intriguing or maybe sparks something that maybe they were thinking about already, because you know how the universe works sometimes.
Right.
So, um, how can listeners get a hold of you if they are interested in learning more about myofunctional therapy or how to take that leap or what that actually looks like for their life?
I would say the best, well, we have a new website, the profitablemyofunctionaltherapist.com. Also, we have a podcast. I have my Instagram. The podcast is very helpful because it really introduces people to the world of myo. Just, it's a great place to start. I'm not huge on social media, so don't expect to see stuff from me every day on social media, but we do put clips from the podcast and stuff on there. But the profitablemyofunctionaltherapist.com, that website has our blogs, all of that kind of stuff. So, and it also gives them a way to reach out to me because most people's questions are like, hey, I'm curious, what would this look like over the next 5, 10 years for me? And that's typically what people start looking at depending on where they are in their hygiene career, that kind of stuff. So ultimately the best place to start is just by booking an appointment with me so we can have a conversation of like what their question is, what their goals are. Everybody has a different goal.
Yeah. No, I think your podcast is great. I listened to a few episodes, so I'll definitely put the link to your podcast in the show notes.
Thank
I
you.
think it's, yeah, I think it's great for people that are just curious to just kind of jump into an episode or two to really hear your experience and expertise. Yeah. So it's really a great resource, and thank you for developing that for the field.
I love it. I love it. It's also a great way. I always tell people it's great for them to see if it interests them, and then also they can learn about me and my quirky personality. Because that I think that really is important, especially because most of my programs I end up working with these students, for 6 months, a year.
Yeah.
So we have to make sure that there's a good balance. And I do meet a lot of people that say, "Hey, I came to you just because I met you online and I loved it." But
Yeah.
I love the podcast. It's kind of like my it might be a lot like why you have a podcast. It's
Yes.
just my creative outlet for the week. And it was like, oh, I got to go tell the girls. My husband's always like, who are the girls? All
Like
those girls,
people
all the ladies.
out in cyberspace somewhere that need to
All
hear
the
my
ladies
voice.
in cyberspace that are heading to work to their hygiene job and they're like, oh gosh, I want to do something different. So it's a great field. And the one thing I do want to say is not everybody has a desire to ever get out of hygiene. Some people are, they take my training so that they can have a plan B in the future. Some people are getting closer to retirement. They don't want to sit around and eat bonbons. They still want to make a difference, those type of things. So, because some people are like, but I love hygiene. I just don't want to do it every day. So it's a great mesh.
I
And a
love
lot
that.
of offices are starting to implement it too. So if I was a hygienist still back in the operatory and I had the opportunity to learn myo and still be, like that's a
Yeah,
win-win. I love it.
it
So
is a win-win. Oh my gosh, it's been so great talking with you today,
yes, thank
Carmen.
you, Billy.
Yeah. Yeah, and to all of our students out there, I hope you have a great week. Thank you so much for tuning in and listening. Tell your friends, share your thoughts and ideas online. And as always, I'm always here if you need me. Reach out. I'll talk to you soon.